As Minister of VSA, Minister of Health, I wanted to just touch on one particular subject that we've been working on, and that is strengthening the cooperation with health from St. Martin, Dutch side, and with health on the French side. You know, we're a small island, and in particular framed against the discussion about the building of a new hospital. I feel that it's critical that we determine what the level of structured cooperation between the French side and the Dutch side will be going forward. In other words, are we going to operate as two separate hospitals, independent of each other, or are we going to say, you know, look, we're a small island, let's synchronize our development plans? So that is very much the direction that I, as minister, believe that we should be going. That if we're looking at developing a service on the Dutch side, why would we have the French side build the exact same service and compete for clients? Instead, I believe that it makes more sense to look at developing complementary services. So in other words, if the Dutch side is expanding and developing one service, that the French side take that into account and not invest in developing a competing service, but rather invest in a complementary service that's not offered on the Dutch side. So if we can synchronize our healthcare development plans, I believe that this has tremendous economic value for both sides of the island. And if you look at it, what it does is it accomplishes a number of things. If you want to bring in a specialist, for example, to the island, if by cooperating, that specialist now can serve both sides of the island, their practice becomes much more financially viable, rather than just bring in two specialists, each one servicing their side of the island. So this involves a number of points for discussion, including, besides a coordinated development plan, this also means that we need to think about how do we synchronize standards. So as we look at the development of the hospital, we are looking at developing it with European standards. So we need to make sure that from a standards in terms of the facility that there's synchronization. But there also needs to be a synchronization in terms of staffing. Language is obviously an issue. We understand that some of the doctors on the French side or some of the staff on the French side are already engaging in language training classes. But these are things that require a period of time to develop. And I think that as we look at the development of the hospital, if it's an independent hospital, not taking into consideration the French side, it would be a different development plan compared to if there's a synchronized coordination. So we had very positive meetings last week, and those meetings will continue, and that's with the Observatoire Saint-Martin. We've met with Dr. Louis Jeffrey and Mr. Arnaud Benet, and we will continue discussions today, and that circle is now expanding, including the SMMC, including the Public Health Department, really geared towards, as we finalize or as we work towards the development of the terms of reference for the new hospital, that we have a structure in terms of what the cooperation between the Dutch side and the French side will be. Thank you very much.
Speaking about the strengthening of the cooperation between the Dutch and French hospital, is the French side, Dr. Jeffrey that you spoke to, are they competent to discuss and make agreements on behalf of the state? Because, of course, Medicare fall under the state of France on the French side. Being that said, one of the other things that I would like to ask, if it was discussed and if there was any agreement upon this, should there be an agreement made, would the French hospital and the Dutch hospital, when it is renovated and built, or even now, then start accepting the insurances, for example, SZV on the French side, and the Dutch side accepting the carte vitale, which is the social security from the French side. Because just recently, a pregnant woman went to the hospital. She had insurance, but she was denied access to the hospital, and what ended up happening to her baby, it was dumped on the beach wherever she gave birth. That's besides the issue, but my main question is there an agreement where the both sides hospital is going to then accept both sides, the insurances of both sides of the island? And is the state able to make the French side hospital able to make solid agreement that they can live up to?
Your points are excellent points. It's true that the healthcare on the French side is a national issue. We are actually in discussions about whether we need to escalate this to a higher level for that discussion. So that discussion about competency is a correct point, and something that we are in the process of addressing. There's a meeting, I think, next week in Martinique, where we're going to, I guess, the APS. There's a sort of a regional organization. So your point about, so the first point is, do you want to cooperate? Is there a will? Do you see the benefits of it? Is there a desire for it? And I think we've established that from both sides there is that desire. The next step is, yes, how do you work it through the political process to make sure that the correct authorities are making those agreements? Because as we look at the development of the hospital, they need to be very firm agreements. They cannot be, yes, we'd like to, maybe, but I'm not sure in the future, because we're going to make development plans based on that agreement. So absolutely, they have to be solid, tangible agreements. And naturally, just an agreement to provide services to one another without working out the financial component makes no sense. The whole point of this is that it has to be financially beneficial for both sides of the island. So absolutely, synchronization of the insurances is a key point to be worked out. But there is already currently some level of referral and exchange of services happening. So there is a mechanism where it is working, maybe not optimally yet, but there is some already exchange of services. So it's just a matter, I think, of structuring it and formalizing it going forward.
I have a second question for you. Currently taking place at SZV. I think I mentioned this to you on the phone. Quite a number of sick people that were placed on sick leave because of their medical condition. And when they go to SZV, they're not seen by a doctor, but SZV cut short the days off they get. For example, a woman on crutches went to SZV. She got a certain amount of days off from her house doctor. SZV said no. You go back to work the next day. The woman was there up to yesterday again because her house doctor is insisting that she stays home. Does SZV have doctors that actually examine patients to see their medical condition, or do they just have somebody that does administration work and decides without seeing the patient whether or not that patient is capable and able to perform on the job?
You have mentioned this to me. I haven't had a chance to look into it as yet, but certainly the determination whether somebody's sick leave should be continued is a medical decision, not an administrative decision. So I'm not sure what their processes are for that, but I do agree that it's something that I will look into for you.
Thank you. Minister Marlin, yesterday in Parliament, I listened to the Parliament meeting, and some of the questions asked by some parliamentarians amazes me. I did hear you said a number of times that St. Martin cannot spend what it doesn't have. One minister even went as far as saying, this is what we inherited, and he's sitting next to you. Another minister was actually given flack for trying to get a policy in place to collect the casino fees. And then you have a member of parliament who appointed a minister in the former government who did absolutely nothing to get these fees. How do you intend to deal with these issues? Because obviously you're getting some flack from Parliament about the 2000 budget, which is very meager. How do you intend to deal with these issues coming forward? Because I think Friday is the parliamentary debate as to whether the budget is going to be passed.
Thank you, and good morning to all, and a special good morning to the students of Learning Unlimited. Maybe I think you have answered the question. It is more statement than a question. You've answered it yourself. What is lacking? And I think, particularly for the sake of the students who are here, but those who are listening as well, when government presents a budget, in all my years in the political arena, there was maybe once or twice in the history that you had an opposition sort of agreeing with government on its budget or parts of the budget. It's usually if opposition wants to get certain things from government, that it would lend conditional support to the budget in order to get a concession on this, that, or the other. You have to realize we are in a political year in the sense of there's an election in the next couple of months. There was a change in government that began actually on the 30th of September with a motion of no confidence. So those who supported the previous government are now in opposition. With an election a couple months from now, and this budget being the budget that will take us into the election, the members of opposition would do their best, at least those who were present. There are some who chose to stay away during the Central Committee handling, but those who are there are going to try and make it look as if the budget is the worst thing that happened in the last 25 years. Interesting, though, that the draft of the budget was prepared by their administration, the government that they supported at the time. I do not expect some of them, and some before even reading the budget, went up front and make statements that it doesn't have my support. But what one would expect whenever the budget is voted on in Parliament next week, that the 8 members supporting the government would vote in favor for, and it is expected that generally those not supporting the government would vote against. So I did not expect, and I don't think anybody expected, anyone from the opposition to come and say, great job, guys, you are heading in the right direction. They're going to try and criticize any and everything. One member of parliament who was critical about continuity, member of parliament Leona Marlin was like, yes, government should have continuity. And I tried to point out, continuity has nothing to do with the policies of the government. If there are policies that have started, let's say we have study financing, for instance, a new government is not going to come in and say, well, Peter, Paul, Mary, and Harry were given study financing, so we are going to revoke it. It's a right they have. If you have a doctor's card and it was done the right way, if somebody was being appointed as a civil servant and it went through the transparent channels, we would never reverse something like that. But you have certain issues that are political. The government can choose to do something differently from what the previous government was doing. And the fact alone that a government changed not after an election, but changed shortly after an election, a year after, is a sign that there will be a change in the direction the government is going into. And one of the issues that I pointed out, for instance, where you would have a change of direction is nothing major, but when I visited the census office last week, it is interesting that the same member of parliament was head of the census office for the past years. And when I saw the deplorable condition, and when I'm saying deplorable, not that the files were ransacked, no, they had them neatly stacked on shelves and whatnot, but in hot rooms without any ventilation. The only thing that you have is a door and a light. But there's no ventilation, there is no airco in it. And I'm basically to find out that, yeah, we don't have any money, or it was not budgeted for. No, this minister intends to change the direction that was heading into. And while we do not yet have probably the funds to build a new building, but in the absence of, and even if it's a year from now you're going to build a building, then let us now put in what we can do at best would be, let's say, to put air conditioning in those rooms. So there are so many things. The past government was planning for an election or preparing for an election in 2018. So therefore, they may have had other priorities than this government would have. So it's a normal thing. So I did not expect the budget debate, at least in the Central Committee, neither in the public session, to go any different than they trying to criticize the government for the budget that they have presented.
Cedric, may I have a follow-up on that
No,
very
we'll
trend?
take that follow-up in the second round of questions. We have to proceed. Hilbert Haar, Today newspaper, you have the floor.
Yes, thank you. Minister Marlin, a question about the intervention in the decision by the Council of Ministers to call off those controls by the multidisciplinary team. Somebody in Parliament has already sent out a press release and said this is unlawful. And when I read that, I thought, is that really so? I found that this would only apply if there are members in that multidisciplinary team that fall under the Ministry of Justice, but that with other, when it's civil servants, that the Council of Ministers would have every authority to do so. What is your opinion about that?
Again, you were here on Friday when the statement was made by my person saying what the decision of the government was. It was late Friday afternoon when all through Thursday night is when I think the first reports started to come into ministers about these things that were happening, the manner in which it happened. And we tried, several ministers tried to get from their SG what it is went down, and nobody seemed to have known, nobody. We finally got hold of the head of immigration almost, I think it was going on 5 o'clock, and the gentleman came here where the Council of Ministers was present, and there too he said he heard or he knew that they were going to conduct the raids or the visits, but he does not know what went down there either. So that is when we said, listen, well, since nobody seemed to know, and there are indications that things went really out of hands, to avoid any further escalation of sorts, let us suspend these things until we know and we get information as to what it is went down. The agreement was that by Monday they should have the information and would share that. Monday I spent most of my day in Parliament. After that I had other meetings again until late last night. And this morning I came in with the intention of contacting, because I know, this is one of the things people would want to know, has it been dealt with or not? Up till now, we have not received a report as to what is the truth about these things. So people got to, of course, as I said, it's an election year, and they're going to try and find all kind of things. Oh, the government this and the government that. There are those who are trying to make it sound as if the government is out there defending a business or holding their hand above a business. Absolutely not. As a matter of fact, this morning, I'm having a meeting with a manager of a business, and I got a complaint from a worker that the general manager, the manager is doing things to the employees, and in particular to this employee, that I'm saying, no, this should not be. What did I do? When I learned about it, I picked up the phone and called the person and asked them to come and see me this morning because I have certain issues to discuss. I didn't go into the details of what it is we're going to discuss. Now, it is not my business, so to speak, to lecture to a business person how they should, but I think it is wrong. And if we have a manager, and then the discussions always become polarized when it's a manager, a foreigner who is not from here and who doesn't have, let's say, Dutch nationality, who has been living here probably for a shorter while, it gets a total different spin and atmosphere. It's like, oh, these foreigners coming here to do what they want with locals, and you get a kind of polarization. So to avoid any further escalation of any problems that they may be, because we are not saying no, you can't, or no, you should not, or if a restaurant is not living up to hygiene standards, that, oh, you should let them operate. Absolutely not. That is not the way government wants to go and will go. Neither are we saying if you don't have the proper licenses, that, oh, you should still operate. It's a difference if somebody applied for a license. It is taking long to finalize. And if the minister or the department advises the minister, listen, it's only a matter of finalizing the paperwork since these people are ready and they want to operate, minister says it's okay if we tell them. The minister knows, and I'm sure, depending on what it is, the minister might say yes once the process is completed within the next week or two. Let's say, would have no objections. But it is wrong if a company is violating rules and they are not operating in accordance with their documentation, that the control unit, if they have a job to do, they should be given the space to do their job. But it is how the job is done. Yesterday, there were reports again in one of the papers about a 74-year-old or 94-year-old person at a poolside and who was asked for ID, et cetera, et cetera, et cetera. The story, I guess, is known to all who have read it. I don't know if it happened for true. But if these things are happening, is there something wrong with government finding out from those who are carrying out their investigations as to why these things happen or do not happen? Yesterday, a local person, is telling me they were stopped by a police and asked for a driver's license and was given the driver's license, and then the police says, I want your ID. And the person said, why do you want my ID?
Yeah.
I have given you my driver's license. My driver's license is an identification. Yes, but you need to have an ID. It almost became an altercation. Another person, local person, tells me they come to control at a business place. And what does the person from immigration, somebody from immigration, is asking them for a labor registration. So an overview of who is working here. And the person said, the business manager says, that's none of your business. If SZV wants my labor registration to see who my employees are, SZV can have it, but not immigration. You are border control. You have no business interfering with my labor registration in terms of who my employees are. And I guess that is why joint controls are carried out, because then if SZV wants to know if they're compliant with paying their SZV premiums, because if you have 50 employees and you got to pay for 49 of them or for 50 of them, are we getting the correct premiums? The tax office might want to know, are you paying withholding, turnover tax, or pay of your own tax for these employees, etc. But sometimes the lines get crossed, and some of those who are conducting an investigation at some point in time may ask for things that would sound redundant. And in closing on this issue, that has nothing to do with it, but you have people, let's say, go to the bank to cash a check, and they're told they need 3 IDs.
2 IDs.
No, I mean, it is so ridiculous. It is so ridiculous. If a check is written to William Allen and William Allen goes with a driver's license, it's a legal document given by the government. If you have an ID card, but then somebody's telling you you need an ID card, a driver's license, and a passport. The average citizen doesn't even walk with a passport. Okay?
I conclude that you do not think that the intervention of the decision of the Council of Ministers was unlawful. That as
No, the
no.
government, the
Have that
Council of
authority.
Ministers, and I spoke on behalf of the Council of Ministers. The decision wasn't, you are not allowed to do your job as immigration. You're not allowed to do your job as police. You're not allowed to do your job. But the joint operations, seemingly there was something wrong there. And we said, guys, let us find out what went wrong, because if there's a misuse of power, of authority, or there are things that are being done that are misinterpreted, we need to deal with them. And yes, you oftentimes, only when one person goes public on something, then you might hear, yeah, it happened to me too, it happened to me too, it happened to me too, it happened to me also. So this is all we are trying to make sure that things are done in a proper way.
Okay, thank you. One quick question for Minister Lee. How are we doing for Zika? Do we have any reported cases yet here on this side of the island?
No. As far as I know, there's no reported cases here. And I think it's also important, I think the French side has one or two. But as far as I understood, these were not cases that were actually contracted in St. Martin. These are people that I understood contracted from when they traveled abroad to a Zika-prone area and then returned feeling ill.
Yeah.
So as far as I know, there have been no cases in St. Martin where somebody who hasn't traveled contracted Zika. So I think that's an important distinction to make as well.
Do you get any indications of people who are staying away from the island because of Zika?
I have heard of a number of cases where people have canceled their trips to St. Martin. They've, as far as I can tell, they've mostly been women that are currently pregnant, that obviously they've been advised by their physician not to travel. And I think that from the hospitality industry, from the airline industry, in those cases, they've been, refunded money. Cancellation policies have been revised to permit for that.
Okay, thank you.
Hilbert, thank you very much. Andrew Dick, Daily Herald, you have the floor.
Good morning to the ministers. Prime Minister, just one question on the fire department. Any update on the accreditation for them? Or is it, I see that the budget has been increased for this year. So just wanted to see if that's part of it.
No, there's, since my visit to the fire station, there has been no further discussions directly, at least not between the minister and the department, but these are works in progress. And of course, once the budget is established and approved, they can begin using funds that are available to them.